All right, thank you for joining us today. I appreciate having the lovely Lyndia here with the new partners to help us talk about Medicare. This continuously pops up many times as you get close to 65, you get all these magical things coming your way on what to choose, how to choose it, what makes sense for me. And so, as a person who's in financial planning, it's too hard for us to even think through all the different options. That's why we have Lyndia and new health partners to help us. So please, if you could, just give us a little bit of intro about yourself and how you got here.
Absolutely. Thank you so much for having me. This is one of my favorite parts of my job. I am so passionate about educating people on Medicare. Of course, that is not how I started out. I did not set out to go into health insurance or Medicare. That was not my dream. I got placed in health insurance through a temp agency, and I absolutely fell in love with it. I fell in love with taking something incredibly complicated and trying to make it understandable and clear and breaking it down in terms that people understand. So I really find passion in taking somebody who says, I know nothing, there's no way I'm ever going to get this, and turning that around for them, explaining things, breaking things down. And like I said, more than anything, helping people because Medicare, of all things, can be incredibly complicated if you allow it to be. If you don't know kind of what you're doing, which is 90% of people on Medicare, unfortunately, because it's designed to be confusing, it makes it a little overwhelming. So I like to take some of that stress away from people. I have been in Medicare since 2017. I am actually a certified Medicare insurance specialist. As it stands now, I am the only certified Medicare insurance specialist in the state of Indiana. That is a FINRA recognition. And so essentially, that just means that I have done all of my training for the last 7 years, and I have never had an actual founded complaint through any of the carriers that I represent. Here at Move Health, we're a brokerage. So I represent dozens of companies all over the United States. So I can help people pretty much anywhere with their Medicare. And I have the background of being able to give you the actual advice that you need, as opposed to trying to put you in plans that I'm specifically contracted with or that's going to give me some kind of bonus or kickback. I have the ability and I get the honor of actually saying, hey, your work plan's better for you, or the plan you're in already is going to be best for you. My ultimate goal is making something very complicated clear and concise.
Yeah, I can tell from my side, I've been able to send people your way and got nothing but positive feedback. And it's just such a value add. So we really appreciate you being able to help. When you think
Absolutely.
about it, what does a typical engagement look like? How do you help people? How do you do that?
Absolutely. So typically we get our all of our leads from financial advisors. So your financial advisor will connect you with me directly. We always start off with an introductory call. So this is typically a 10, 15, 20-minute call where we can get to know each other a little bit, figure out, make sure that you live in a state that somebody here works in, and then kind of figure out what your timeline is. When it comes to Medicare, we have specific timelines that we want to reach whenever we are having our conversations. Once we have that conversation, we're going to schedule you for a full advisement when it makes sense to do so. And with that full advisement, what that kind of looks like for you is we're going to do Medicare 101. I don't care if you're 64 or you're 78. I'm going to do Medicare 101 with you first and foremost, because I have found that in my career, most people have no idea how traditional Medicare works. And I think it's important to start there. Like, this is what Medicare does for you. This is what it doesn't do for you, most importantly. Once we learn the foundations of Medicare, we're going to talk about the differences between the two different ways that you can pick the gaps up in traditional Medicare. You've got one way versus the other. There are pros and cons to each. I do try to remain as objective as I possibly can, but I have a favorite for lots of reasons. And I always explain the reasoning of why that's my favorite to all of the clients that I talk to. Ultimately, it is up to the Medicare beneficiary what they choose to go with their Medicare. But once we've had our Medicare 101, we've determined what's going to be the route of action we want to take. I'm going to give you step-by-step instructions on what your next steps are, whether that is applying for Medicare and how to do that, whether that's going to your employer and getting specific forms filled out to start that Medicare application. And then your next step from there is going to be reconnecting with me on another call so that we can enroll you in those plans. So not only do I educate you, help you choose the plan that's going to work for you, I'm also going to facilitate that enrollment. And then I will be here as your advisor anytime you have questions, anytime you have concerns. You're going to be able to reach out to me directly. And this time of year specifically, which we'll get into here in just a second, I'm going to review those plans for you because every year they change. So we need to make sure that going into that next year, the plan that you're currently in is still going to fit your needs.
I mean, truly, we appreciate it. There's so much there. And as people are looking at it, you already alluded to it. Picking a favorite, that mystical supplemental versus advantage. I mean, when you
Right.
start to think about it, obviously it depends on each person's scenario. But why do you start to lean one way or the other? So what are just a few things?
Yes, so the supplement is my favorite route, and there are so many reasons why. But just off the top, the reason that I particularly like the supplement is you have freedom. not only to go wherever you want to go, because your supplement is going to be accepted anywhere that traditional Medicare is accepted. That's about 95% of doctors and facilities nationwide. So, reason one, you can go where you want, whether you have homes that are in different states. If you have family that lives in a different state, you know that wherever you are in the United States, you're going to be able to use your insurance. I also really like that you can use it at really top tier treatment facilities. So, treatment facilities like MD Anderson and Mayo Clinic and Vanderbilt, these places are very particular on what type of health plans they accept. Traditional Medicare with a supplement is their primary source for Medicare beneficiaries. So if something major happens, you get diagnosed with something really serious, you can get top level care somewhere. Another reason that I really truly love the supplement is the freedom to get the things done that you need to get done. Your supplement has to cover whatever traditional Medicare covers. No questions asked. So no referrals to see specialists, no prior authorizations for services. If your doctor says, hey, you need a shoulder replacement, you've been hitting that pickleball paddle a little bit too hard, you're going to get a shoulder replacement. You do not have to prove to the insurance company that you need that done. Your doctor's already proven that for you. And for me, that's what gives me the peace of the mind of the supplement. The last thing that I want to do when I'm 65 is argue with insurance companies. I've got about 10 years of it under my belt already, and I'm going to want to break when I'm 65.
I mean, I don't blame you one bit. I mean,
Mhm.
one of our favorite parts of using you specifically in youth health is that we just naturally see spouses, one being 65 and the other not being when you go to retirement. So, we've spent time on the pre-65. That's one of my favorite parts is that you're able to help us navigate both of those different scenarios at the same time. And so a lot of times people ask us, hey, I'm turning 65 halfway through the year. What is a good way to think about general enrollment versus special?
Yeah, absolutely. So right now we are in the annual election period. That runs from October 15th through December 7th every year. This is for people who are already on Medicare plans. So if you've already got a Medicare Advantage plan, you've already got a prescription drug plan, this is the only time of year that you can make changes or adjust those things. For people who are turning 65 in the middle of the year or retiring outside of the general election periods, you have something called a special enrollment. You're starting Medicare for the first time in your life, whether that is because you're retiring or because you're turning 65. With that, you have a window of time before and after that you can choose your supplement or your Medicare Advantage plan or your prescription drug plan without having to feel like you're limited or pressured to do it during this general enrollment period.
People, it tends to come up a lot. They're 65, they're still working, they love to do what they do. Do they have to get on Medicare at that point, even though they're on their employer plan?
Generally, no. So, as long as you work for an employer that has more than 20 employees, you do not have to take Medicare yet. And this is actually what we typically recommend because Medicare has a cost and you don't want to have to pay for Medicare if you don't need to, especially considering that most work plans are considered affordable. They have to meet an affordability factor for the employee themselves. So, your work plan can't cost you more than 8% of your income. That's not always the case with Medicare, depending on our big friend Irma, that we can always talk about later. You could be paying hundreds and hundreds of dollars for Medicare. So there's absolutely no point in doing that if you're still actively working. It also would limit your ability to contribute to an HSA because as soon as you are Medicare eligible, as soon as you start Medicare Part A, your eligibility to contribute to a health savings account ends. So for people who are in high deductible health plans and they're still working full time, don't enroll in Medicare yet. As long as you meet that criteria of working for someone who has more than 20 employees, you can absolutely defer it. If you're not taking Social Security yet, you don't have to do anything. It's just going to defer on its own until you go to retire and you apply for Medicare at that time.
What are a few things, if you could explain that a little bit, maybe potentially a few other things to think about as you consider your options?
Yes, Irma, she's my not so great best friend. Irma is the income related monthly adjusted amount. I always make the joke that this is the you did well for yourself tax because the higher your income is, the more you pay for Medicare. The real consideration here is looking 2 years in arrears. So when you start Medicare, whatever year you're in, they're looking at what your income was 2 years before. They're going to judge the cost of your Medicare based on that income. This is especially important for people doing Roth conversions as well and keeping that in mind. Baird is so amazing about knowing these thresholds and if they're doing Roth conversions and pulling things out, keeping you below them. But it's still always something worth considering. IRMA is one of those things as well that if you're retiring and you're going to have a substantial change in income and you are assessed that IRMA, you can appeal it. You can absolutely get that removed or at least get it lowered. So that's one of the things that you want to consider whenever you're getting to Medicare age. Another thing is that health savings account thing. So Just in general terms, if you are deferring Medicare and you defer it 6 months past your 65th birthday, you're still working. So if you get 6 months past, you're still working and you retire a year, 2, 3 years down the road, when you apply for Medicare Part A at that time, they're going to backdate your Medicare Part A 6 months. They always backdate at 6 months. And that's the moment that you need to stop contributing to your health savings account. This is why when we talk about timelines, this is one of the times that we want to talk to you. We want to talk to you 6 months before you plan to retire so that I can tell you if you're contributing to a health savings account, you need to stop contributing now because they're going to backdate that Part A to that month, that first of that month. So it's really important to keep that into mind. Another thing that's really important to consider is if your spouse is older than you. So if you are still working, your spouse is on your employee plan and they are turning 65. It is still worth considering going full Medicare for your spouse because sometimes whenever you're adding a spouse to your employer plan, that's where your costs kind of skyrocket. It has to be affordable for you, the employee. It does not have to be affordable for your spouse. And so in some cases, it's less expensive to have your spouse go ahead and go full Medicare. It's not only usually going to save money for premiums monthly, it typically is going to save you for out of pocket amounts and deductibles as well. So, especially if you've got a spouse who is using their coverage, if they have a critical illness, if they had a major accident, full Medicare is going to give them a very low deductible Medicare with a supplement in any case. And so, sometimes that's worth considering as well. And so, having a conversation with me if your spouse is over 65 or turning 65, I think is really beneficial as well.
No, I could see that for sure. When we have these moments, a lot of this stuff becomes urgent in that time period. When you get through it, obviously we're going to use Lyndia and move health partners to help with that. What is the engagement from there on out? Like we got through that urgent moment. We fast forward a few years. Should they continue to talk with you? How do we deal with something like that?
We are a little on both sides of that fence. So when we look at things, most of the time we're just reviewing your prescription plans or your Part D for Medicare when we talk about our re-engagements throughout the years. You can also check your prescription drug coverage on Medicare.gov at any time. I am such a big fan of having a Medicare.gov account if you are Medicare eligible. Medicare.gov keeps track of all of your medicines. They keep track of all the doctors that you use. And so this time of year, this October 15th through December 7th, you can log on and you can review your drug plan yourself. And it will put all your medicines in there and it will tell you exactly what drug plan is going to save you the most money. If you have a lot of complicated medicines or you need like prior authorizations or formulary exceptions or you're taking oral chemotherapy or things that can just be really expensive, I'm always happy to help because this is where Medicare can sometimes really need an expert. I also am really good at finding like pharmaceutical assistance programs for things if your medicines are a little bit too expensive for you. So this is where you would want to re-engage with me and say, "Hey, Lyndia, I need you to check my prescriptions for me. I've had some changes. I've had some new scary diagnoses." That's another time I would love for you to reach out to me. If you're diagnosed with something scary, I don't want you to feel like you have to go through that alone. Let me know. Because at this point, I know how to better cater to you for future years. Like maybe we need to have a little bit more of a comprehensive drug plan. Maybe we need to do XYZ or look into an F versus an N or whatever it may be. I want to know how to continue to serve you moving forward, especially when you're going through something really scary or anxiety ridden. It's important to have someone hold your hand through those things because some things can get lost in the cracks. And then just anything really, I am such a huge fan of questions. Shoot me an email if you've got questions about anything at all. This time of year might take me a day or two to get back to you, but usually we're pretty responsive for any of the questions that come through to us.
You can see the value out of trying to walk through your different scenario, knowing that you're not a captive agent and you don't represent any certain companies. I mean, how do you get paid for helping?
That is my favorite question. When we started Move Health, it was really important to us founding members that we didn't feel pressured to have high sales tactics. I didn't want to feel like a used car salesman because to me, no offense to used car salesmen, but to me, this health insurance and Medicare thing is such a big deal. It really needs somebody who is going to be honest with you and isn't pressured by their wallet or their pocketbook. So to me, it was important when we started Move Health that we're salaried employees. So every agent here, we make a salary. So we get paid the same amount, whether we tell you to go with your work plan or we enroll you in a supplement out in the open market. The way that Move Health gets paid is by the insurance carriers themselves. So if I place you with an insurance carrier, that insurance carrier is going to pay Move Health a commission. It's important to know because most people don't, that commissions are already built into the cost of supplements supplements and advantage plans and under 65 coverage. So you're paying for an agent, whether you use an agent or not. So you might as well get your money's worth.
I could 100% see that. I mean, it's already there. Let's use it. Let's get a second eyes on it because that is obviously a big decision when you look at it. So, I appreciate your time today here. I want to make sure that the easiest way for us to connect clients and people that we work with you use a few different ways, right? It's either through an email introduction or we can schedule time. But now we have access to your platform where we can send you that link, all the information, and make sure you get time with her. So just want to say thank you for your time today. And if anyone has questions, please let's reach out. That's Lyndia and your partners. Thank you.
Thank you so much for having me. I appreciate you so much, Dominic.